Hi, and welcome to another episode of Just Ask Your Dentist. Today's questions, actually two, since they're in the same category. The first one comes from Angelique 00. And Lapan asks, Dr. Pereslete, I'd like to ask you a question to clear up an ongoing debate between me and my roommate. After brushing your teeth, should you rinse out the toothpaste remaining in your mouth or no? Along the same lines, if you rinse with a mouthwash, should you rinse with water to get rid of that residual mouthwash taste? Thanks. And thank you, Lapan Angelique 00. I'll tell you, I think it's probably a good idea to rinse out the toothpaste after you brush. Number one, you're going to get rid of any remaining toothpaste that might be stuck to the insides of your mouth or around your teeth. And number two, whatever you brushed off, you're going to be rinsing out too. So it's probably a good idea to rinse out after you brush. As far as mouthwash goes, kind of depends on the mouthwash you're using. There are certain therapeutic mouthwashes that require you to keep the mouthwash in your mouth for, say, like a minimum of 30 seconds to be effective. And then spit out the excess, but don't rinse. These types of mouthwashes have medicaments in them like fluorides and certain other antibacterials that will help promote healthier, cleaner mouths. So in mouthwashes like that, you want to keep that in your mouth. Keep the residual in your mouth. Don't rinse it out. There are other mouthwashes that you probably can't stand the taste of, and you want to get that out of your mouth as soon as possible, like Listerine or something like that, where it's really a lot high alcohol and burns and is right terrible. Go ahead, rinse it out. So it depends on the mouthwash you're using. I hope I answered your question, and I hope I was on the right side there. I'm hoping you won the debate against your roommate. Anyway, good luck. The next question along the same lines comes from Tim Williams, and he is asking me if I have any suggestions on a mouthwash or toothpaste brands. I think he was referred to us by the Quip video where we opened up the toothbrush from Quip, which was an excellent product, by the way. So Tim, to answer your question, I don't really have a preference, and I'll tell you why. The toothpaste, and in some instances the mouthwash, is like frosting on the cake. It's not really the toothpaste that's doing the work for you, it's the toothbrush. And we did a video on that earlier on the proper techniques of toothbrushing. If you brush your teeth properly, honestly, you don't need toothpaste. Years ago, the advertisers got a hold of trying to promote their brands, and they're developed into an advertising war. It's probably back in the 40s. The truth is that most toothpastes are really generally the same product. They all have beneficial ingredients in them, fluorides and enamel byproducts that help recreate or restore enamel, antibacterial ingredients, anything you can name, toothpaste have it in them now. So if you want to use that, be my guest. Toothpaste, great product, good for you, but as far as a preference, whatever you have out there that you like that tastes good, that has a fluoride in it, that has some type of enamel rebuilding agents in it, use. Those are my preferences. Mouthwashes, kind of the same way. If it's got beneficial ingredients in it that will help promote healthy mouths, fluoride, things like that, go ahead and use them. Again, it's not really the toothpaste or the mouthwash that is your magic bullet. It's the toothbrush and the floss. It doesn't matter what kind of toothpaste you use or what kind of mouthwash you use. If you don't brush properly, none of it's going to work. So, there you go, Tim. Keep the brushing up. And thank you both, Lapan Angelique 00 and Tim Williams, for your questions. And we'll get back to you at the next episode, so go ahead and post, and I'll try to get back to you as soon as possible. And remember, questions only regarding dental materials, because I'm just a dentist. Thanks again. See you next time.